Hello, everyone. My name is Gerardo Duran, or G, as all of you call me. Today, my presentation is over polycystic kidney disease, so we're going to go ahead and get started. What is polycystic kidney disease? Polycystic kidney disease, or PKD, is a genetic disorder that causes fluid-filled cysts to grow in the kidneys. These cysts can vary in size, come in clusters, and are non-cancerous. PKD damages the kidney and can lead to kidney failure. Here are some images of how the kidney looks like with all those cysts, and you can see it's not very, looks kind of gross. So probably should have put a trigger warning on that. What causes polycystic kidney disease? Polycystic kidney disease is an inherited disease that doesn't have a known cause. It's often passed down through families. There are two types of polycystic kidney disease, the most common being autosomal dominant and the other being autosomal recessive. In the dominant form, like I said, it's most common. Only one parent needs to carry the disease to pass it down. The child has a 50% chance of having it, and it typically shows up between the ages of 40 to 50 years old. The least common and rare type is the recessive, where both parents have to carry the gene. Symptoms can start either at or before birth, and like I said, it's really rare to have that one. In this slide, I put a list of symptoms. So the first being hypertension, UTI, blood in the urine, back or side pain, frequent urination, or kidney stones. In some cases, it can be asymptomatic, but it just depends on the progression of the disease. Some patients have no symptoms, and some patients have all these symptoms plus some. So just kind of something to let you see. Diagnostic imaging is important in identifying and assessing the size and number of the cysts. Ultrasound and MRI provide the extent of kidney damage, monitor disease progression, and detect any complications. These exams are non-invasive and help guide treatment decisions. So pretty much is the eyes of being able to see what's going on within the kidney. MRI is used to diagnose and evaluate polycystic kidney disease by providing detailed images of the kidneys and surrounding tissue without using ionizing radiation. It can assess the size, number, and distribution of the cysts. It gives you a more detailed image of what's going on and can pick up on the smallest cyst and measure the volume of what's going on. It can see if it's progressed or if it's gotten better, so to say, with the treatment that's given. It just overall gives you a better image of what's going on. Another modality that's typically used first is ultrasound. It's used first because it's low cost and it provides a real-time image of what's going on in the kidney. It's good at detecting the presence of the cysts, and like MRI, it helps determine the size, number, and distribution of cysts, but it has limitations. So it's primarily just used for seeing if there is cyst in the kidney initially. So my primary modality was MRI, and here are some images that I was able to get of an axial view and a coronal view. You can see the clusters of all the different sizes and shapes of the cysts that are here. And it's pretty neat, pretty cool to see. The detail isn't that good because when I uploaded these images and made the detail go bad, I don't know why, but they're pretty good. So here are two examples of that. As stated in my previous slides, MRI shows a bit more complex detail. It can visualize smaller cysts and view severity. To me personally, the MRI images remind me of nerd cluster candies, how there's a cluster of them and they're all different shapes and sizes, and it's a good visual representation of what polycystic kidney disease kind of looks like. So here I provided some ultrasound images. You can see the abnormalities in them. Uh, they kind of look like air bubbles within the kidney. They don't look normal, and these are pretty obvious that they're cysts. So these are pretty cool. Here's a left kidney, and kind of gives you an insight of what that looks like. Here's another ultrasound image with a kind of cartoon to kind of demonstrate how the kidney looks side by side. On the ultrasound, it looks like a dark fluid filled area and kind of looks like bubble wrap to me or a cluster of grapes. So that's some one way I would describe it. And yeah, there is no known cure for polycystic kidney disease, but the patient can control symptoms and slow the growth of cysts and try to prevent the loss of kidney function by controlling blood pressure, drinking more water, staying hydrated, avoiding caffeine as much as possible, and just having an overall healthier lifestyle. As stated before, there is no known cure for polycystic kidney disease. Treatment is used to avoid complications and alleviate symptoms. The prognosis varies on different patients. Some people may go all their lives with kidney function and being able to manage their health, but in more advanced cases, the patient may require dialysis or even a transplant. This is my reference page. I used a few online sources in my Bontrager book. So yeah, thank you so much for watching and listening, and have a good day.